health care as right, not a privilege of the wealthy. And universal wellness should be practiced, from the time we're children in our public education system throughout all of our lives. And the kind of healthcare I would like to see implemented in this information age is a global internetworked medical database of all known symptoms, of all known signs, symptoms, any type of associated, detrimental health effect, of all ailments worldwide, collated in a database, that basically has, okay, these symptoms, these signs are associated with these ailments. Some signs, some symptoms are only associated with certain ailments. Other signs and symptoms are universal throughout just being in poor health. But what I'm getting at is through a universal database, you can start to narrow down the associated ailments with those signs and symptoms, and have a computer that stores the information internationally of medical experts and all known documented diseases, chronic conditions or otherwise, acute, of mankind. Having documented all those, then with each and every one of those signs and symptoms, somebody comes in and says, I've got the following signs and symptoms, or they can enter them in themselves if they're healthy enough, or they can have a data entry specialist enter them in for the doctor, for the physician, the general practitioner. Okay. Also, the general practitioner adds any observable signs and symptoms not already disclosed by the patient. This assumption that patients don't know what they're experiencing, or that it's all in their heads by medical practitioners, has got to cease. The arrogant presumption that, because they are lacking knowledge of certain medical conditions, that they're instead just going to call you a mental case, has got to cease. That kind of maltreatment, as far as I'm concerned, man, should be civilly and, frankly, I think, criminally liable. I've been in 4 states now, and I've tried to tell medical practitioners what happened to me, and because my story is unusual and difficult to believe, instead of getting actual competent medical care, I have gotten universal maltreatment. 4 states of physicians that, if I'd had undercover cameras, would be paying me through the nose in malpractice suits. So maybe I could find somebody that actually takes their profession seriously. The ignorance regarding the genetic trait of Wilson's disease must cease. At least 10% of the global population has this genetic trait. It leads to an accumulation of heavy metals in the body, which leads to every known form of serious and terminal ailment. Currently, Big Pharma and the medical industries are profiteering hugely off the myriads of signs and symptoms that develop in these people with this genetic trait. The genetic trait early in life leads to actually higher electrical impulses and conductivity in the body, quick twitch muscles. Some of them become very powerful athletes, world-class athletes. Some of them highly intelligent, driven people. But later on can lead to stuff like Parkinson's, Bell's palsies, cancers of every kind, etc. A certain amount of metals is necessary in the body for it to function at an optimal rate. And in a non-toxic, ecologically, diverse and biologically safe world, without all the, poisons and chemicals and pollution, these people probably had ideal genetics for, accumulating the right amount of metals just based on foraging and hunting. But in our polluted societies and toxic societies, they're starting to develop ailments such that I know for a fact that Wilson's disease is the number one common genetic trait related to Alzheimer's right now. They've found that aluminum and heavy metals are common, but what I'm getting at is the reason why in those patients they're finding those concentrations is because they have this genetic trait of which I'm speaking that hardly anybody seems to know about, and especially the medical professions. And as such, when I told them, man, how much I'm suffering, man, I have not only not been able to get any pain-relieving substances, which I attribute must be divine will, because I'm frankly against having to take those substances anyways. But in desperation, when I was on the brink of being in so much pain that I was seriously considering maybe trying to find a physician-assisted suicide state or country, in extreme suffering, I couldn't get, even when I broke weak and tried to seek pain-relieving, medications, I couldn't get them. Because universally, every quack I met, and I call them quacks because they deserve it, universally just thought I was some kind of drug addict. I haven't taken hardly medications except for over-the-counter cough syrup or flu multi-symptom in decades. So I'm not a drug addict. Thank God, man, Christ delivered me. But I couldn't get pain medication because the physicians that I went and saw were universally ignorant of Wilson's disease and its signs and symptoms. And universally also, I mean, it's one thing to be skeptical of when I tell them what I've been through and still alive to sit there and tell them about it. It's another thing not to run the tests to prove that I'm telling the truth. I couldn't, even as an insured paying person, get tests run that would have proved, early on that I was telling the truth and would have helped me medically, because I universally came across such severe malpractice, man, that I would be laughed at and or scoffed at and or treated like as if I was a mental case, simply because of their lack of knowledge. Other physicians and doctors universally lied to me, and as far as I'm concerned, committed felony kidnapping thereby in order to maltreat me, in order to attempted to prescribe substances that were, literally cause permanent brain damage and organ damage, which I refuse to ingest, any sane person would. As far as I'm concerned, it should be illegal for anybody to manufacture, let alone prescribe, any substance that they won't take themselves. I see modern psychiatry and psychology as an extension of Nazi eugenic fascism and the ability for them to euthanize medical patients. And whether you want to believe I'm telling the truth or not, I witnessed it with my own eyes that they were using those substances to literally poison a man to death in front of me, and he knew he was dying because of the medications. And I went to U.S. prosecutors, I went to local authorities, I went to anybody I could think of to try to save this man's life, and nobody helped me. The guy's probably dead. I say that every one of those doctors and nurses that administered that medication, that said, do not administer this medication to anybody with hepatic issues, should be in prison. I say they should be in prison for premeditated homicide of one of the worst kind. They literally poisoned their own patient to death. And you can say I'm mental. I'm telling you that the FDA is approving substances that are so toxic they carry lethal warnings. None of those substances should have been approved for human ingestion. I guarantee the doctors that are prescribing those substances won't take them, and I guarantee that the pharmaceutical companies manufacturing those substances won't take them. They're that toxic. So how can it be legal to force anybody else to ingest those substances? The man's eyes were bright yellow. His skin was orange and blotchy. He had sores all over his body, and he was in a locked down ward, not able to get drugs from anywhere else, so he wasn't in there drinking or on other drugs, with jaundice. He had been locked up there under their so-called care for an extended period of time, and the medication was killing him. And it was obvious it was killing him. And I can't, still to this date, haven't been able to get anybody to take me seriously that, frankly, doctors and nurses are literally euthanizing people in certain places in our country, in certain lockdown wards, out of media sight and out of the public sight, especially individuals that have no family ties or no friends that visit them, and they're getting away with murder, as far as I'm concerned, of the worst kind. Furthermore, the homicide attempts I survived in the hospital were plausibly deniable. I, as a medical lab professional, know that you can use blood, to kill people. So what they do is they use incompatible blood, and which causes an acute hemolytic reaction, which causes pulmonary edema and cardiac arrest. And a little is that much incompatible blood in your system. 60 milliliters can kill a person, and they gave me 3 full units, and they did it intentionally. And there's evidence to prove that they did it intentionally, and they tried to murder me after that first attempt failed. They tried twice in one hospital to murder me, and I've survived to tell about it. And I'm telling you that these doctors and nurses must be put behind bars, and these kinds of practices must cease immediately. Okay, which brings me to why I'm such a proponent for universal wellness and healthcare worldwide. Because my own personal suffering that I have met in a so-called modern society of so-called technologically advanced society, in my opinion, is not just horrific, but inexcusable, and completely inexcusable, and frankly criminal. And all the rest of them were guilty of malpractice, every one of them. If I'd had them on camera, I'm sure the public would universally agree with the way I was treated was inexcusable, unprofessional, unethical, and all of them guilty of malpractice. I had one doctor just flat out, actually 2 doctors, laugh at me. I'm telling them that I'm in so much pain I can't really stand it. I'm in unbearable pain and suffering. With so much extreme fatigue, I feel like I'm on the brink of keeling over most every day, barely hanging on, and they find it amusing. Do you know how infuriating that is to a person that is truly telling the truth, that they're suffering unbearable pain? What, do they think I was telling some kind of story? Think I drove 4 states to waste all that gas and energy to tell them some kind of amusing story? That's how I was treated. I don't want anybody else ever to be treated like I was treated by these so-called medical professionals. The ignorance around Wilson's disease, and I'm going to call it Wilson's genetic trait because it is a genetic trait, it's not a disease, must cease. And the recognition that I'm telling the truth, that these doctors tried to murder me by an incompatible blood transfusion, needs to be universally understood by any physician wishing to treat me, that I am telling the truth. That the reason I'm in such severe pain, I know for a fact as a medical lab tech, has to do with my immune system. That my immune system has rejected all the blood I was given, and I know that it's my immune system causing the amount of pain I am in pervasively, like lupus, because I took probiotics that I'd never taken before, and my immune system immediately was distracted for about 12 hours, and I experienced a significant amount of pain relief in the process, and then slowly but surely, the pain resumed thereafter. So I know my immune system is the predominant reason why I'm in severe pain every waking moment, and that I'm also, as a result of being in severe pain every waking moment, severely exhausted and fatigued, because I'm in so much pain it deprives me of rest. And I'm in pain because these doctors and nurses, like I'm telling you, and I'm telling the truth, I'm telling the world now, tried to murder me. And they tried to murder me, and I'm telling you why they tried to murder me.